Hey, welcome back to the Big Ranch Show. Thank you for joining me. There's been a lot of talk recently over Medicare for All. I'm not sure where you stand on the idea of Medicare for All. I think it's a good idea, considering how the ACA has been being eroded over the last few years and how it's not covering as many people as it was before. I also believe it would actually be cheaper for the federal government in the end to cover it that way, um, as opposed to the subsidies we're giving out for private insurance from the federal government. I think that would be a better idea, a better direction to go. But I'm not going to sit here and lie to you and say that it's not possible that somebody that was here illegally could end up on Medicare or Medicaid. It does happen, and it can happen. Now, personally, I don't think that if you come here, you should necessarily have access to our services. If you come here illegally. But according to a 1986 law, we have to treat these people if they come across the border, even if it's illegally, that they can be treated in a hospital. But the problem is, treating people in a hospital is a lot more expensive than treating them at the doctor's office. And this came up in a hearing back in April, where a congressman had an exchange with an actual doctor who explained to her this 1986 law and how it was fiscally, cheaper or more responsible to do it through Medicare for All or Medicaid, something to that extent. That it would be cheaper for these people to get treated at, say, a doctor's office than it would be to be treated at a hospital. Could you imagine somebody goes to the hospital for a cold or something, and the hospital charges the government $2,000 for that? Could you imagine? I guarantee you it's more than that, and it happens every day. Now, like I said, I have my qualms with Medicare for All, especially with the idea of people here that are undocumented having access. But at the same time, if we're already paying thousands of dollars or millions of dollars a year even in caring for undocumented people in hospitals, and it's fiscally responsible to do it in another way, shouldn't we? This Congress lady was all concerned with her constituents' tax money going to pay for the health care of illegal immigrants. And I understand her complaint. But their money already is based on a law signed by then President Ronald Reagan. The one that Republicans see as the second coming of Christ. Who treat as if he's some kind of, standard bearer for what a good conservative is, even though he wouldn't know his own party today. At the end of the day, Ronald Reagan had a soul. At the end of the day, Ronald Reagan was a decent human being. He knew we couldn't just let people die. Which is what these Republicans seem to want these days. Now, I'm no fan of Ronald Reagan. I'm no fan of everything he did. But I know deep down, just like George W., that he loved this country. That he only did what he thought was right, whether or not people agreed with it or not. And I can guarantee you, looking back, I didn't agree with a lot of his policy ideas. But the fact is, he signed into law the ability for undocumented illegal immigrants to be able to seek health care at hospitals. We've learned since then that is not a very good way to take care of the situation. That it would be cheaper to do it other ways. It would save taxpayers money by doing it through Medicare for All. And I'm not sure what plans they're looking at, what all the plan entails that they're looking at in terms of Medicare for all. That hasn't really been made too public as of late. But the fact is, a doctor had to point this out to a lawmaker. So one of our lawmakers knows less about our federal government and our federal laws than a doctor. Thank goodness for people like this doctor who stood up for the facts. You can have your opinion. We can disagree on things. But the one thing we can't disagree on are facts. Facts are facts. They don't change. So let me know down in the comments what you think about Medicare for all. I think it's got some good points. I think it's got some bad points. And I think we could come together as Americans, left and right, to solve this problem. And I don't mean Congress. I mean, I believe Americans, everyday Americans could come together and come up with a better plan than Congress would ever come about. And that's unfortunate because our Congress is supposed to be for the people, by the people. But they're not. At the end of the day, they are for the lobbyist, by the lobbyist. And they should have to wear sponsorships so we know where they're getting their money from. Anyhow, this has been the Big Rant Show. I've been your host, Jacob Keck, and I'll see you down the road.